We're learning more about your vision care, and I'm joined today by optometrist Dr. Jordan Dyker. So let's talk specifically about diabetes when it comes to vision health, because there's a bit of a correlation between the two, aren't there?
Absolutely. So as many people may know, diabetes can have a big impact on your vision and eye health. So as an optometrist, we have a very important role in taking care of people's eyes and making sure that things are healthy and that they're seeing well. We do recommend people who are living with diabetes or are pre-diabetic come in yearly for eye exams. And we do communicate within the whole team with your primary care practitioner, and sometimes, as needed, we'll refer you to ophthalmology for further care or treatment.
Okay, so if somebody gets that diagnosis that, they're living with diabetes or they're pre-diabetic, are there things that they're going to have noticed already with their vision, or is this something that you kind of are making those discoveries along the way? Like perhaps they wouldn't notice a difference on their own.
Yeah, I love that question. It is different for every person. So there are people who come in here without a diagnosis, and we will see things in the back of the eye, such as diabetic retinopathy, that will clue us into, you do need to visit your primary care practitioner. There's some things to be investigating here. Other people will come in with a new diagnosis and there will be nothing in the eye. Okay. So it's very individualized per person. The other thing that can happen is diabetes can make your prescription fluctuate as the lens inside your eye swells with increased blood sugar. And these are things that we keep track of. So when people with diabetes come in, we're going to ask, what is your blood sugar level? Is it stable? Because that can impact your prescription as well. So everybody's a little bit different, and we want to make sure we're taking the best care of anybody who's concerned about their blood sugar by checking every year.
Okay, so this is fascinating, some of the things that I just picked up from that comment there. So the idea that you could almost be the first indication that there is something wrong and that they need to check with their doctor about a perhaps diabetes diagnosis. But then how you mentioned it could be fluctuating. So sometimes we hear of people that are maybe pre-diabetic and able to get their health under control, that they kind of roll themselves back into a healthier position. Could that improve the eyes?
Yes, absolutely. Often with the fluctuations I was mentioning, that's going to be directly related to your current blood sugar levels. So if you're fluctuating, that's where we're often going to see that fluctuating prescription. So if you're in good control, we're happy with it, we're going to get you a good prescription, which is fantastic. And then, of course, the more maintained you are with your health, well-being, and blood sugars, the healthier your eyes are going to be as well.
Of course. So again, what a fascinating conversation this has been. Perhaps you learned something today. What we most definitely learned is that you have to stay on top of those eye exams. So you recommended yearly annual eye exams. If somebody doesn't have a family doctor, how would they go about, or an optometrist, pardon me, how would they go about finding one?
Yeah, wonderful question. So we do have a website, optometrist.mb.ca. On that website, you can see any optometrist near you that are accepting new patients, and also specifically patients with diabetes. So feel free to visit that, and you can find somebody to take care of your eyes.
Dr. Dyker, I learned so much today. Thanks so much for having the chat.
Thank you for having me.